Hello, good evening, my people. How are day? Thank God it's the second day of January 2026. I can't believe we're in 2026. How time flies. Anyway, welcome back to my channel. Thank you so much for all of you who watched my first video, my inaugural video, as I would like to call it, yesterday. I thank you. I really appreciate all your feedback. We are going to take note. We are taking note of all the feedback, all the corrections, all the advice. We are going to take everything into focus. But one thing I want to let you know is that we can't please everybody. We can't do everything everybody wants, but we will try. We will try. Every day we will try, but we'll just keep trying until we get it. Anyway, once again, we today I'm coming to you live. Not really live. Um, just what time is it right now? Around to 8 where I am right now. So, well, today I'm bringing to you a very very important topic, which is known as ADHD. Um, in full, ADHD means attention deficit hyperactivity disorder. That's a big one. That's a mouthful. But it's not a mouthful, or it's not strange to most people in the Western world. Yeah, they deal. A lot of people deal with ADHD. Yeah, that's the name they give it. Where I came from, where I was raised, where I was born. ADHD. Now, king they go take comot am o. You say you get ADHD from my papa. Now serious whooping. Because what is ADHD? ADHD is a problem, like the name says, attention deficit. It means a person is short of attention. You know, if you sit down still. Anyway, don't let me jump ahead of myself. Look at the name alone. Attention deficit hyperactivity. Attention deficit. The person can't get hyperactivity join now. That's big problem. Double whammy. So ADHD can affect both the children and the adults. So I want you to note that for us. It is not only for kids alone. It affects both adults and children. So once again, I want to welcome you to this channel where we talk about mental health. It's going to be mental health, behavioral issues, psychiatric issues that we're going to be talking about. So today, what is ADHD? I will explain what the full meaning is. But in a layman's language, ADHD means the brain works very fast. That's just it. That's just the truth. Yesterday I was trying to explain that mental health can, some of the things that can cause mental health can be genetics, um, environmental, it can also be neurological. These three factors can make person have what's it called now, mental health issues. Now, when you now take some external substances like you drink igbo, you smoke igbo, you drink ogogoro, all this shisha, all this stuff, they can make it worse. So that's the issue. So let's come back to ADHD. It doesn't mean the brain is broken. No, your brain is not broken. Anybody who has ADHD, it doesn't mean the brain is broken. It just means that the brain needs assistance. It needs help to slow down. It's not all the time you have to talk when you're not supposed to talk. But some people keep talking. They just want to talk, talk, talk because the way their brain is wired, that's the neurological factor now. The way their brain is factor is just want to talk, 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 and talk. So another example I want to give is compare your brain. Anybody with ADHD, compare the brain with a race car. When the brain is supposed to be racing like a bicycle, is now racing like a race car. You know how fast a race car can be. A race car is very very fast, unlike the bicycle. The bicycle takes it slowly. It's slower compared with the race car. So that's why the kid with the ADHD is restless, is talkative, is not having attention, is playful and all those stuff. So children and adults can have ADHD, like I said earlier on. ADHD in children. Children with ADHD may struggle to sit still in school. This is not good for students. Any kid who has ADHD will find it very, very difficult to pay attention. He will not be focused in school. He will be restless. uh, they will talk a lot. They can't sit still. How teach I want to teach that kind of person? It's going to be very, very difficult. But in some continents, you know, they don't. There's very little understanding about this. They think the children, that particular person who has ADHD, is lazy, is stubborn, is crazy, or is being abused at home. All of this, which is not really the case. So adults with ADHD may forget appointments. They will struggle to finish task. They can't stay on task. They are restless. They feel restless inside or feel overwhelmed easily. So because of this, they might struggle at work. They might not be able to keep their jobs because with this attitude, um, your employers or your supervisor might say you are not pulling your weight, so they let you go. So effect of ADHD: when ADHD is not understood, people can feel frustrated, ashamed, or sad. Children especially may struggle in school, like I said earlier on. But one thing that is very, very sure that I want you to know is that ADHD does not only come with the negatives, it also has its own advantages. People with ADHD have been found to be very, very creative. They are curious because of the way their mind or their brain is wired. They just want to know. They are curious. They 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 go the extra mile to find information about topics, about issues. Where me I go stop, then they continue from there. They carry on. They want to know more. So ADHD treatment is helping the brain. How do you help the brain? Because it's a brain thing. So in order for you to help yourself, especially those with ADHD, you have to um, follow. You must have a doctor. A doctor must see. You must see a doctor regularly. For what? To prescribe medication for you. I'm talking about the solutions now, or the interventions for people with ADHD. You can be prescribed medications like stimulants, um, methylphenidate, that's a stimulant. Vivance is a stimulant as well. Adderall is a stimulant as well. So these medications are very, very potent. They are very, very strong. And these are the medications a lot of people want because it keeps them focused. It makes them to become focused. But people who it's not everybody that wants stimulant, and it's not every situation that requires stimulant. You can take medications like atomoxetine. You can take a Kebri. That's a very new one. It's a very good medication. You can take Kebri. You can take Wellbutrin as well. Wellbutrin is the second line of treatment for anybody with ADHD because it helps you a lot. And the issue with the stimulant is when you are hooked on stimulant, you are focused on it, and in the environment and in the Western world these days, because of a lot of medication abuse, drug abuse, the government is tightening up on stimulant, on control medication. So it's becoming very difficult for providers to prescribe these medications. Before they even prescribe you with all these stimulants, you have to do a lot of lab works. They have to check you thoroughly to make sure that you are not smoking igbo, you are not smoking shisha, you are not smoking ogogoro together with this stimulant. Because what a lot of patients do is they combine it with all these other street drugs that I've talked about. So um, once again, medication is like the glasses. This glass where they wear, so the medication is just like it. This glass will make me see properly, but it does not change the fact that I am still who I am. If I have this what's it called now, ADHD now. Medication does not change the fact that I have it. Then another thing you can do is you can see a psychotherapist where they can teach you coping mechanisms on how to control your mouth, how to stay still, to sit still, how to focus, especially when it has become a big problem onto you. So this is what we are talking about today. ADHD is not a crime that you have ADHD. It's not a crime that it doesn't make you a bad person. It doesn't make you a stupid person. It is just the fact that you have it, and because you have it, you have it. There's nothing you can do about it. The major issue now is how you are managing it. Are you managing it properly? Are you taking care of yourself? Are you taking your medication? Are you sleeping right? Are you eating right? Are you exercising? Are you seeing your therapist? So those are the questions you have to ask. You are not alone. A lot of people have it. So thank you so very much, everybody, for watching this second video. I'll get back to you again very, very soon with my other video. Thank you.